Hi guys! Many of you asked me for some treatment videos, and that's why today I'm going to show you one of my treatment combination methods with Botox and hyaluronic acid. There we go! When patients see me asking for beautifying procedures, I always make sure to listen carefully to what they want to achieve and to assess the initial state and anatomical circumstances so that I can realistically define what is attainable. This 40-year-old attractive patient asks me to look after a few perceived issues, namely her nasolabial folds and her so-called puppet wrinkles that pull down from the corners of the mouth. In addition, she is concerned about her under-eye circles, frown lines, forehead wrinkles and crow's feet around the eyes. And to round things off, she would like her cheekbones a little more chiseled. At first, they may sound like a lot, but I will show you that we can get this done wonderfully natural and indeed really beautiful. My proposed plan of treatment for this patient is as follows. I will treat the frown and forehead wrinkles, crow's feet and lower part of the puppet wrinkles with botulinum toxin, short Botox. For the under-eye tear troughs, the cheeks, nasolabial and puppet wrinkles, I'm going to apply some hyaluronic acid. Before we start with the treatment, of course, thorough disinfecting on all sides is mandatory. For the filling and remodeling of the tear troughs, I will first estimate the length of the cannula, which is the hollow injection needle. Then I deposit a small amount of anesthetic into the site where I will insert the cannula. That way, all will happen with minimal pressure to be applied and absolutely painlessly. The same again from the other side. While the small dose of anesthetic is doing its job, I'm preparing the areas we have planned for Botox injections. I interact with the patient to give me some mimic and gestures, in this case a very angry frown, to activate the relevant muscles and allow me to identify the precise spots where to place the Botox for optimal effect. The needles I use are extremely thin and, for various reasons, do away with the need for anesthetics. For background, Botox has originally been the name of a registered drug by a certain pharmaceutical company. By now, however, that name has become widely established and a catch-all term, so that we may use it here for the sake of simplicity to describe a wide range of products of similar type and effect. For the treatment areas on the forehead, I will let the patient also raise and play with them to help me defining the optimal injection points. I talk with the patient about every step on the procedure, both before and during the treatment. That is because I think it's important to communicate and keep people in the loop. Let's now continue with the crow's feet, which can be treated well with Botox because they are so-called mimic wrinkles. Botox is a protein extracted from a bacterium. If it is injected into muscle tissue, it specifically blocks and puts to rest the nerve impulses to the muscle, which, as a result, can't get tense anymore. The effect achieved heavily depends on the dosage. Botox is therefore suitable for wrinkles that are caused by too much muscle movement. Let's move on with the tear troughs. The anesthetic at the entry point is fully effective now. First, I will use a wider needle to basically establish an access point through which I can then insert the injection cannula. I used so-called blunt needles for that. These are atraumatic, which means they are easy on the tissue and non-damaging while delivering the filler to where it needs to be placed. Unlike sharp needles, these ones have a blunt tip, protecting the many sensitive blood vessels and nerves underneath. And they are also longer than sharp needles. The extra length allows me to work throughout extended areas of tissue. You may notice that I'm guiding the tip of the cannula with the other hand. This is extremely important in the area around the inner corner of the eye for better control and to avoid any complications. When I insert hyaluronic acid into the tissue, I prefer to inject it while retracting the needle. That is because it is gentler in general and gives much more control for shaping, in addition to being a safer way to doing it. By way of background, hyaluronic acid or hyaluronan is a long-chain multiple sugar molecule that is naturally produced by our body and plays many important functions, especially as a key component in connective tissue and has immense water-binding capacities. Now I will open the next access tunnel and give it a bit slack in all directions. Then we'll insert again the rounded cannula that carries the hyaluronic acid. When inserting the cannula, I will move a bit to identify the path of least resistance where I can minimize impact on the tissue. That way also I can assure that the patient has no pain. There are many different products which differ in hyaluronan content, particle size, viscosity, type of stabilization and durability. For me, a few products stand out for their superior quality and workability. Now the areas need to be cooled down. It is important that the cooling pads are not too cold. Ice cold could damage the tissue. Then the patient needs to sit up because I will fine-tune my procedure, for which I need the patient's face upright to get the best impression of results so far and bits that might still be worthy of some rework. In this case, I will use a thin sharp needle for the lateral areas of the under eye circles. I will continue with the nasolabial folds and use another, more volume-building hyaluronic acid preparation. I will also inject some of that in the puppet lines mentioned. And to prevent the corners of the mouth from being pulled down too much by muscle activity, I add some Botox into the area responsible for that muscle movement. Finally, I'll treat the cheeks. Here I place the hyaluronic acid directly onto the bone to model the cheeks, building them up from the bottom, so to speak. That gives a perfectly natural result. As you may have noticed, the patient has been completely calm and relaxed throughout. The effect of Botox will not be fully developed for a few days, and the already visible effect of the hyaluronic acid will continue to improve. Hence, it will be about 2 weeks' time until we may judge the final results. Well, we are done now. The patient will meet me for a checkup 2 weeks after treatment. She's obviously extremely happy with the outcome, and all results have turned wonderfully natural, even though we have had to treat quite a large area and all over the face. I think the unique art of face modeling is to leverage the best possible material and apply the precisely right amount of it in the exactly right areas. I love to guide and accompany my patients on this beautifying journey. You see, combination methods can achieve very natural results. Thank you for watching and thank you for your likes and subscriptions. See you soon, take care and all the best to you.